And we've seen some, I'm sure, some terrible coverage on the news recently about the drug war in Mexico. An obvious question is, why would people be willing to engage in such criminal terrorist activities in the streets of Mexico on a daily basis? The answer is the exceptional profits they're making from drugs. If you've got the possibility of making $1 billion a year, and the Medellin cartel had an annual turnover of $90 billion, then you're willing to kill people for that sort of money. You know, the rewards are so extraordinary that people engage in these sort of criminal activities. So the first thing that prohibition does is it hands these markets into criminal enterprises who can reap exceptional profits. The second thing that prohibition does is it makes risky activities even more risky. So it shifts the supply of these goods and services into black markets, into people who have no real concern about the people buying these products, no real desire to control quality. And that leads to all sorts of problems. So where boxing is banned, fights still take place. Those fights take place without proper medical assistance, without proper advice to boxers, without proper referees, without proper restrictions. Equally, the greatest risk of taking heroin, for example, really is overdosing from very high purity of drugs, or taking drugs that have been contaminated, and again, that leads to lots of deaths. And you may recall in January this year, there are, I think, at least 7 deaths in Edinburgh for people taking heroin contaminated with anthrax. I think if you know, Tesco's or the drug equivalent of Tesco's were selling heroin, they would hopefully ensure the product wasn't contaminated with things like anthrax. But when criminals sell it, that isn't the case. Third thing that prohibition does is it criminalises people who would not otherwise be criminals. So prohibition, if you like, creates consensual crimes. People who have no desire, if you like, to rob people, to steal from people, to go about mugging people, may wish to take drugs. And if they wish to take drugs in this country or in most countries, they're going to have to go outside the law. And that clearly creates a hazard. In America, they see the statistics. There's presently, I think, about 500,000 people in American prisons purely for non-violent drug-related crimes. And most of these people are very young people who the chances of really, if you like, a straight career being ruined by going to prison for possession of what can be quite small amounts of cannabis or marijuana, really crimes that shouldn't really be crimes, arguably. So there's a cost there, again, of prohibition. It creates criminals, essentially. The second thing that prohibition does is it imposes opportunity costs on society. So if we're going to prohibit things, we need a police force, we need customs, we need drugs, we need people to investigate all these crimes. And that firstly means that the public sector is bigger than it might otherwise be. And it secondly means that resources that might be devoted towards, if you like, crimes with third-party victims, perhaps real crimes, that money gets diverted to pursuing these consensual crimes. Again, the figures are quite staggering. I think the annual budget of the American Drug Enforcement Agency is about £2.6 billion a year. It's not as big as the drug cartels, obviously that's probably why they're losing the war on drugs. But nevertheless, it's still a substantial budget. Fifth thing that prohibition does is it increases public ignorance. Let me give an example. So one might be willing to speak to a doctor, say, about alcohol or perhaps fatty foods or whatever it might be that's concerning you about your health. But I think most people would be reluctant to speak to a doctor or the GP about taking illegal drugs, about taking perhaps ecstasy or cocaine, whatever it might be. That means that people are ignorant perhaps of the side effects. They're not getting good advice, good information about the drugs that they're taking. So while paradoxically it's often said that one of the reasons why we should prohibit drugs is because people don't know enough about them, when you prohibit these things, it actually increases ignorance of the products. Now, again, all the costs that I've mentioned, all the failures of prohibition I've mentioned, might be worth paying if it actually worked. But the bottom line is there's absolutely no evidence that prohibition works. In fact, all the evidence is to the contrary. There's some statistics here, a couple that I'll talk through very quickly. One is the biggest study of the use of cannabis was done by the University of Amsterdam in the 1990s. As you may be aware, cannabis is de facto legal in Holland, has been since the 1970s, has been de facto illegal in America since, I think, the 1920s. And the University of Amsterdam did a study of cannabis use in America and in Holland. And they found that of people aged over 12 who had used cannabis in their lifetime, in America the proportion was 32.9%, in Holland it was 15.6%. So people are much more likely to smoke cannabis if they live in America where it's illegal than if they live in Holland where it's legal.